Hi, welcome back. I'm Tamara, and this is Beauty Within the Soul. So, I wanted to let you all know I'm having surgery this coming Friday. The surgery I'm having is called ACDF, which is the Anterior Cervical Discectomy and Fusion of the C4, C5 area, which is in the middle of your funnel, up on your neck area. So I thought this would be a great time for me to share what it is, why I'm doing it, what I'm feeling, and what the recovery's like. I'm also doing this because when I was doing research, there's several people who've had this, who's gone through this journey, but it's been a few years. So I thought I'd go ahead and share my journey. So if ever anybody in the future, near future, is going to be having the surgery, maybe these videos will help. So, if you or someone you know might be facing this kind of spinal surgery, maybe my journey will help ease a few of your worries. So, I'm just going to kind of give you what my pre-op and it's supposed to be my pre-surgery and exactly what ACDF is. So, please stay until the end as I'm going to give you an update on what my channel will look like in the next few weeks. So, what exactly is ACDF? Well, it's in simple terms, it's a type of neck surgery. Anterior means they go through the front of the neck, which they'll go through the left side of my neck right here. Cervical refers to the spine in your neck area, and discectomy means they remove the damaged discs. And in my case, it's between the C4 and C5 area. And then fusion means that they then fuse the two bones together using a bone graft and a small plate, small implant, and then they will take a plate and two or four screws or something like that, and that will hold it together. And the recovery time, the total recovery time is a whole year, but the main recovery is basically 6 weeks to 3 months, where I'm going to have most of my restrictions. You know, my orthopedic surgeon told me this is one of the most commonly performed spine surgeries. And in fact, it's one of the simplest ones he's done. It Where I'm having it done, the nurse practitioner told me that it is the simplest surgery that they do. So that kind of helped calm my nerves a little bit. So, why am I doing this and how am I feeling? Well, I'm having this done because I've had a lot of pain and numbness from my neck down to my arms, especially on the right side, but it has happened on the left side. And my hands, a lot of numbness. I've had some headaches. And for the past few months, I've been losing my balance. And I'm going to be honest, when my doctor told me that I was slowly going paralyzed, I got pretty scared. So, how am I feeling about it? Well, yeah, I'm pretty nervous about it. It involves my spine, and anytime you hear a word fusion, you naturally start worrying about it. But you know what? I trust my doctor. He's done this hundreds and hundreds of times, and everything I've read and been told reassures me that ACDF has a high success rate, especially when one level is involved, like mine, the C4, C5 area. Some people have to have like two or three levels done or more. So I'm pretty lucky. So, my restrictions after my surgery, what I've been told, what I can and cannot do. So, I cannot do any lifting more than 10 pounds for at least the first 3 months. So, no groceries, no laundry baskets, no bending over to pick up heavy stuff. Lifting, I can't even lift my puppy because he's 16 pounds. But he likes to jump on me, so as long as he's jumping on me, I'm okay, as long as I don't move my neck back and forth. But so he'll just have to jump on me and snuggle with me for my recovery time. He'll like that. No driving for the first 2 weeks, or I'm off of narcotic pain medication and feel that I'm mentally sharp to do that. So it might be longer, a little bit than 2 weeks. I don't stay on narcotic pain medication when I have surgery or anything that long, um, because it does cause stomach issues. So I try not to stay on it. So I will do the best I can to get off of it as soon as possible. Also, I need to walk at least 100 feet 3 times per day, starting right after surgery, the day of surgery. They want you walking because walking will help prevent the blood clots and encourage the healing. So I'll gradually build up from there. And the nurse said, for the first couple of days, you might be walking around my house, 100 feet, and then gradually go outside. So I'll have my daughter helping me, um, or even my mom going out to the mailbox and back. So a little bit as the days go on, I'll get a little bit farther and farther. So I got to get the exercise in. So I will also need to be careful on how I sleep. Some people have to wear a cervical collar, but luckily I don't have to because I'm only having one level done. So that's really good. But I do have to be slightly elevated. And last year, when I broke my leg, my husband and I got the beds that go up, with the top and the bottom go up, and you can adjust it. So I'm really blessed to have that this year. So I didn't have to get one. Otherwise, I'd be sleeping in my recliner, and I know a lot of people do. So, and that would be okay too. I'll probably end up sleeping in my recliner a few times. I'm used to doing that. So, anyway, let's see. No sudden movements. Yeah. No sudden movements of my neck area, especially backwards, bending my head back like that. Or like, how you look at your phone and or your iPad or anything, or even your laptop if it's on your lap, you're looking down. Well, I can't do that anymore during my recovery time. So everything that I do has to be like straight ahead. Like I have my camera while I'm talking to you is straight ahead, so which is great for me. I'm used to doing that. So I've already kind of got an area to where I will just have a pillow on my lap, and and I have something hard, and I can watch my iPad or my phone looking straight ahead and not forward. I mean, not forward. I will be able to move my head from side to side. I think they said I would lose just about 3 degrees of, my head going from, instead of from here, it will be like right here. So, you know, that's not bad at all. So I'm very blessed. Um, so, this is going to be a slow and steady recovery. And I'm preparing myself mentally to be patient with myself and with this healing because I don't like to be held down or just limited on what I can do. So, plus with me going back to work, what, 3 or 4 weeks later, part time, I need to get better quickly. So, some of my pre op instructions. So, if you guys have this in the future, this might be your pre op too. I know every doctors are different, they say different things. So, what they've told me that I need to do before surgery is, of course, you have to use the microbial soap 3 days prior. Like I'll be doing it Wednesday, Thursday, and Friday, the morning before my surgery. And all I have to do is, because it's going to be the neck area, I just have to do this, scrub it really good with the antimicrobial soap. Um, so every day for the 3 days. No food or drink after midnight, of course, just like you do with any kind of surgery or even if you're having blood taken. So, um, and that's okay. They did say that I can actually drink anything clear liquids up to 3 hours before my surgery. So in the morning, they will tell you what type of medications, like if you're on regular medications, they will let you know what medications you can take and what you can't take. So um, there's 2 medications that I take on a regular basis that I am able to do, so which is good. And then the other medication I only do once a week, so I'm good to go. So, and I know like some of the medications that you cannot take are like blood thinners, anti-inflammatories, like any of your NSAIDs, the NSAIDs, like ibuprofen, Excedrin, is it? Or Advil. You can't take any of that up to a week before your surgery. And with me, ibuprofen works miracles on me. Tylenol, not so much. But ibuprofen, that's what I use for everything. So that's been hard for the last few days when I've had a headache and some pain, and I haven't been able to take it. And I think I was told that it'll be a few weeks after surgery before I can do it too. So we'll see what happens. It is what it is. So I also already had my pre-op appointment a couple of days ago. And then I had the surgery center already call me, went over all my medical history. I had to fill out paperwork and get that sent in. And they gave me what you know, they will call me the day before the surgery, let me know what time to come in. So where I'm getting my surgery done, they are so on the point. I mean, everything. The only thing that got messed up is that they sent in all my muscle relaxant and my pain medication to the wrong pharmacy. So all I did was email them, and I know by tomorrow morning it will be fixed because they are so good and they know what they're doing. So that makes me as a patient feel so much more comfortable that my I'm going to be taken care of. I can't. It just makes me feel a lot better. So my post-op care after the surgery, they told me that I will have some sore throat, like a really bad sore throat, and I'll have trouble swallowing because when they go through the front area, they will take your esophagus and they move it over for the whole part of the surgery. So then when they move the esophagus and the windpipe back into that area, because they have to move it to get to the spinal area, it will swell up, and so it will be harder to swallow, I was told. So it's basically going to be liquids and soft foods that you can eat, like puddings and mashed potatoes and applesauce and smoothies and things like that, which is fine with me. Um, but I've heard some people have different problems, it takes longer than a couple weeks. Some people, it just took a couple weeks, and then some people even longer. So I think it depends on you as a patient, and how you recover. Um, so, and then let's see, pain medication. I'll be on a pain medication and I'll be on a muscle relaxant. And then because I'm allergic, well, I have side effects of a lot of pain medications, so I usually can't take them. I'll be taking anti-nausea medication along with my pain medication and muscle relaxant. So I'll be doing that for, I think it's the whole 2 weeks. And then they already set up a follow-up appointment for me for 3 weeks out, which is really nice. And I'll go in, they'll do the x-rays, they'll make sure that the fusion is taken effect. And then I was told I will go back 6 weeks later, and then 3 months, and then 6 months, and then a year. So they will be following me through the time. I also got a temporary handicap um, sticker for my car. So if there are days that I feel like I'm just not up to walking, because sometimes when you go someplace, it's really far to walk. And I like to park further away and walk. But there's those days that I'm like, I just don't have the energy. So I got a temporary handicap parking um, little thing to go on my mirror. So, which is awesome. And of course, what I'm also going to be doing is watching for signs of infection, for fever, if my symptoms worse, if the pain gets worse. And of course, you call your doctor if anything seems off. So, anyway, I'm going into this with some fear, yes, but also with hope. Hope that the numbness and pain and losing my balance and my other symptoms just go away and get better. I did hear that the pain goes away first. It's the numbness and the not feeling things that is usually the last thing that goes away. And, they said I should notice pretty fast with me not losing my balance so fast. So I'm looking forward to that because I'll be just standing and I'll lose my balance, or just walking from the living room to the kitchen and I'll lose my balance. So I've learned how to hold on to different things. Um, so hopefully that will be a lot better. And I just know with this being done, I'm going to come out stronger. I have my faith in God that God's going to cover me and He's going to protect me and He's going to bring me out just stronger than I am now. So, with all that being said, my channel for the next few weeks will look a little bit different. I may not get my 2 videos posted in a week like I've been doing, but then again, with the help of with my son, the help of with my son helping me, I may just get in a daily check the first couple of days post surgery. Then maybe I'll do a series on my weekly, maybe for the first 3 weeks, and then my 1 month, 3 months, and 6 month. I might do a kind of series on that. And then in between, I'll be doing other videos, which I'm going to tell you about in just a minute. So if I'm feeling up to it, I know that some people are able to record after their surgery later on that day. If I'm up to it, I will let you all know how I do on Friday late afternoon, early evening. If I'm up to posting, doing a quick, like 2 or 3 minute video, let you know how I'm doing. And then, of course, then day 1, day 2 to day 3, if my son is able to help me get it posted. So in the meantime, that when I'm not posting about my ACDF, because I know some of you may not be interested in, that's okay, because it's not for everybody. I am going to be posting videos on health and wellness, because you know what, I'm going to be limited on the exercise and what I can do. I decided to start a series on getting healthy and the exercise, especially with people over 60. And may have limitations on other things, not just having surgery, but may have other types of limitations. So I've been trying to get healthy for a long time. I do good and then I do bad. And I thought, you know what? If I do this series, I think that will help motivate me, keep me, what's the word I'm thinking of? Oh, I can't even think the word, but keep me um, positive on what I'm doing. And I think, you know what? You guys will probably think of the word that I'm thinking of right now, and I just can't think of it. Oh, accountable. There you go. I'm sorry. Accountable. So it'll help me keep accountable. And so I'm going to get healthier. I know that my walking is going to be, that's what's going to be my first exercise. But also, what I'm eating too, trying to wean myself off of sugar and just get healthier. So anyway, my first video on this will be hopefully a week from today, next Tuesday. So if everything goes well and I'm feeling up to it, that is what's on my agenda, along with letting you all know how I'm doing with my surgery and post surgery. So anyway, feel free to ask me any questions in the comments below, or share your own story if you've had spinal surgery too. I would love to hear your experience, especially if you had ACDF. I would love to know your experience. I'll keep you all posted with updates and how things go. I would love to help you. No, I'm sorry. I can't even talk. I'm already done. Um, it's the end of the day when I'm doing this video, so I'm already tired because I've already been running and doing errands and everything. So my apologies. I would love for you to help me keep my channel going. So by doing this, please subscribe, like, and share this video if you know anybody who is going to be having surgery and might benefit from what I had just shared. So thank you again for joining me today. God bless, and I'll see you next time. Bye.